I am with Dr. Avya Bansal, a chest physician at Bombay Hospital in Mumbai. I'm Namita Jain, a wellness author and a wellness specialist. Doctor, today we are exposed to air pollution, we are exposed to dust, we are exposed to even passive smoking and sometimes smog, and we can't even help it, we can't control. Sometimes we can't even run away from the environment because that is the environment that we live in, or we have to deal with that situation. So, in these cases, what would you recommend to protect lungs?
I think, Namita, that's a very important question, given that we are surrounded by construction activities rampantly across the city. We have poor air quality index, and we've heard numerous people speak about it. The government is doing whatever best it can, but we cannot keep inhaling the poison which is out there. There are certain measures which all of us can follow. Number one is limit the exposure. Avoid traveling at peak hours or avoid activity at construction areas. I tell people don't go for a jog or a walk when the construction activity is rampant. That's late in the evening where you have a lot of dust which is settling down at the bottom. Wear a mask when you're outdoors, which will indirectly prevent a direct inhalation and direct exposure of dust and dust particles to you. If possible, you can keep an air purifier at home or at a workplace, which will improve the quality of air at your home.
I think that is a wonderful takeaway, doctor, because keeping an air purifier will really help the situation. Yes.
So that is what people can do. Also, improving your overall health and well-being will limit the side effects of the bad quality of air which is outdoors. Hydrating yourself well, given the heat which is outside, exercising regularly, yoga, pranayam, anything which improves your respiratory capacity and respiratory health is something which I advise everyone to follow.
So that's really important for all of us to maintain good health, overall health. And for anything where you have a condition, one must consult with a chest physician for specific guidelines. And even in terms of breathing, a specific hospital protocol for breathing and improving lungs is what you would also recommend sometimes, isn't it? For someone who already has a condition.
Yes. So
Yes.
any patient suffering from a chronic respiratory disorder is by default asked to get enrolled in a pulmonary rehabilitation program, which involves a trained physiotherapist ensuring that breathing exercises are taught. There's yoga, pranayam happening, inspiratory muscle training, which is happening at the same time, barring which a nutritionist gives a proper diet chart to improve respiratory quotient. So these are certain measures which are non-pharmacological measures which also improve the quality of life. Because in medicine, at the end of the day, all we are concerned about is improving the quality of life of the patient and having the maximum result to benefit him or her.
Thank you so much, doctor. I think this is such a wonderful takeaway, such useful information. Thank you for your time.
Thank you so much. Thank you.